Have you ever noticed that no matter what you do, no matter how many times you clear your throat throughout the day, that thick, uncomfortable feeling just keeps coming back? That sticky sensation like something is permanently lodged in there that never quite goes away. You clear it in the morning, and it is back by lunchtime. You clear it before a conversation, and it is back within minutes. You have tried warm drinks, honey, lozenges, over-the-counter syrups, and nothing seems to make a lasting difference. And perhaps the most frustrating part is that when you mention it to people, the response is almost always the same. Oh, that is just mucus. It is normal at your age. Do not worry about it. I am here today to tell you something completely different. That persistent mucus in your throat is not something you have to accept as a normal part of getting older. It has a cause, and once you understand the real cause, the solution becomes far clearer and far more accessible than most people ever realize. My name is Dr. Adrian Volker, and today we are going to talk about persistent throat mucus. What is actually causing it at a deeper level than most explanations ever go? 4 specific causes that most people, and honestly, even many healthcare providers overlook completely, and a practical step-by-step plan you can begin implementing today to address it naturally. In 15 years of clinical practice, I have worked with hundreds of patients who had been living with chronic throat clearing and persistent mucus for months, and sometimes years, without ever understanding why. Today I want to change that for you. Before we go any further, I want you to drop a comment below right now and tell me honestly, how long have you been dealing with persistent mucus or the constant need to clear your throat? Just tell me roughly how long. Every single comment get read personally, and today your answer genuinely matters. And if you have ever been told it is just your age, and to simply accept it, please add the word dismissed to your comment, because I want to know how many people watching this have been given that unhelpful response. And if you are new here, I'm Dr. Adrian Volker. Hit subscribe and turn on the bell notification right now so you never miss a video. Now let's get into what is really going on. Mucus is not the enemy. Here's what you need to understand. First, let me start with something important that I think most people have never heard explained clearly, because understanding this one thing changes how you think about mucus entirely. Mucus is not the enemy. I want you to really hear that. Mucus is one of your body's most sophisticated and most important defense systems. Every single day, your body produces a significant amount of mucus continuously, and it does so for very good reasons. Mucus traps dust, airborne particles, bacteria, and viruses before they can penetrate deeper into your airways and lungs. It keeps the delicate lining of your respiratory passages moist and protected. It is literally the first line of defense of your immune system, working silently and continuously 24 hours a day. The problem is never the mucus itself. The problem begins when that normally fluid and manageable protective layer becomes thick, sticky, and difficult to move. When instead of flowing smoothly through your system and being cleared naturally, it stagnates, builds up, and creates that persistent, uncomfortable sensation in the throat that sends you reaching for water or clearing your throat dozens of times a day. And here is something genuinely important that most people over 60 need to understand about why this happens more frequently as we age. As we get older, the muscles involved in swallowing become gradually less efficient. The lymphatic system, responsible for draining excess fluid and keeping tissues from becoming congested, operates at a reduced capacity compared to earlier decades. The tiny hair-like structures that line your airways, whose job it is to sweep mucus upward and outward, work more slowly. And any irritant that enters the system tends to linger longer rather than being cleared quickly and silently. This means that factors which might have caused only a brief and barely noticeable mucus response at 40 can cause a persistent and genuinely bothersome response at 65 or 70. Understanding this context is essential, because it explains why the causes I am about to describe have such a pronounced effect in older adults specifically. I have a patient I want to tell you about, a wonderfully determined 68-year-old woman named Evelyn, who came to see me after 8 months of dealing with what she described as a throat that never felt clear. Evelyn had tried everything she could think of: honey and lemon drinks every morning, steam inhalation before bed, various over-the-counter preparations from the pharmacy. Nothing produced lasting relief. She had been told by two different people that it was simply the kind of thing that happens as you get older and that she would need to learn to manage it. When Evelyn and I sat down together and went carefully through her full picture, her daily habits, her medications, her sleep position, her diet timing, what emerged was not one cause, but a combination of three overlapping factors, none of which had ever been properly identified or addressed. Once we tackled those three factors with the kind of practical, targeted approach I'm going to share with you today, Evelyn messaged me 3 weeks later to tell me that for the first time in months, she had woken up 2 mornings in a row without that feeling in her throat. Evelyn had not needed any prescription treatment. She had needed the right information and the right practical steps. That is exactly what today is about. Cause 1, silent reflux. The first and most consistently overlooked cause of persistent throat mucus is something called silent reflux. Most people are familiar with the idea of acid reflux, that burning sensation in the chest after a heavy meal or a strong coffee. That is the classic version, and many people have experienced it. But silent reflux is different in a critically important way. With silent reflux, stomach acid travels upward not just into the lower esophagus, but all the way up to the throat, the voice box, and sometimes even higher. And because the throat and vocal cords are far more sensitive to acid than the esophagus is, even tiny amounts of acid reaching these areas causes significant irritation and inflammation. And here's the part that makes it so consistently missed. There is often no heartburn, no burning sensation in the chest, no obvious digestive discomfort, just a persistent need to clear the throat, particularly in the morning, a slight roughness or change in the voice, sometimes a mild sensation of something being caught in the throat, and of course, that mucus that keeps coming back no matter what you do. What happens is that the throat, feeling the microscopic irritation from acid contact, produces extra mucus as a protective response. Your body is trying to coat and protect the irritated tissue. This is a completely logical and appropriate biological response. But when the underlying acid exposure keeps happening night after night, the mucus production keeps being triggered over and over. And no amount of throat clearing or honey drinks addresses the root cause. Because the root cause is acid reaching your throat while you sleep. If you find that your throat feels worse in the morning than during the day, if you notice more throat clearing when you bend forward or lie down, if your voice sometimes sounds rough or different, especially in the morning, these are patterns worth paying genuine attention to. The practical approach to silent reflux begins with 2 simple but genuinely effective changes. First, try not to eat within 3 hours of going to bed. When your stomach is still actively digesting a meal and you lie down, the physical position alone makes it considerably easier for stomach contents to travel upward. 3 hours of upright digestion time before lying down makes a meaningful difference. Second, elevate the head of your bed slightly. Not just adding an extra pillow, which only bends your neck, but actually raising the head end of the bed by several centimeters, using a small wooden wedge under the legs of the headboard. This gentle, consistent incline uses gravity to keep stomach contents where they belong overnight. Pro tip 1. If you take any anti-inflammatory medication regularly for joint pain, arthritis, or other chronic discomfort, please discuss this specifically with your doctor in relation to your throat symptoms. Certain commonly used anti-inflammatory medications can relax the muscular valve that separates the stomach from the esophagus, making it easier for stomach contents to travel upward. They can also reduce the stomach's natural protective lining. Both of these effects can contribute significantly to silent reflux in people taking these medications regularly, without them ever realizing the connection to their throat symptoms. If this is already starting to explain something you have been wondering about for months, hit the like button right now. It genuinely helps this video reach more people who have been told to just accept this as part of aging. And tell me in the comments, have you ever tried nasal rinsing? Did you notice any improvement in your throat? I want to know, because your experience might encourage someone else watching to try something they have been hesitant about. Now let's talk about cause number 2. Cause 2, post-nasal drip from chronic sinus congestion. This is one of those causes that most people with persistent throat mucus are living with without ever identifying, because it does not always produce the dramatic symptoms people associate with sinus problems. Sinus congestion does not always mean intense pressure headaches and severely blocked breathing. In many older adults, chronic low-level sinus inflammations simply produces a steady, quiet draining of mucus down the back of the throat, particularly when lying down at night and during the early morning hours after rising. You go to bed, and while you sleep, the sinuses that are mildly inflamed and producing excess mucus drain slowly downward by gravity into the back of your throat. You wake up with that thick, uncomfortable feeling and the immediate need to clear your throat before you can even have your first sip of water. Many people experiencing this have been buying antihistamine tablets from the pharmacy for months, assuming they have ongoing seasonal allergies. But in many cases, these medications dry out the mucus temporarily without addressing the underlying inflammation. And dried, thickened mucus that is harder to move is often more uncomfortable than the original problem. The most genuinely effective approach for this cause is regular nasal rinsing with a gentle warm saline solution. A simple mixture of warm, previously boiled water with a small amount of plain salt, used to gently flush each nostril once or twice daily. This washes away inflammatory irritants and allergens, reduces the congestion driving the postnasal drip, and keeps the mucus thin enough to be cleared naturally. It sounds remarkably simple, and it is. But the consistency with which it produces real improvement in people who apply it regularly genuinely surprises most patients who try it. Pro tip 2. When doing nasal rinsing, always use water that has been boiled and cooled to a comfortable warm temperature, rather than straight tap water. Tap water in many areas contains traces of microorganisms that are completely harmless when swallowed, but should not be introduced directly into the nasal passages. Boiled and cooled water eliminates this concern. Also add a very small pinch of bicarbonate of soda alongside the salt to your rinsing solution. Bicarbonate helps neutralize acidity in the nasal passages and supports the thinning of mucus more effectively than salt alone. Cause 3. Medication side effects. The third cause is one that surprises almost everyone when I mention it, and yet once you understand it, the connection makes complete logical sense. Certain medications that many older adults take regularly can contribute directly to persistent throat mucus, either by promoting reflux, by drying the mucus and making it thicker and stickier, or by triggering a reflex that increases mucus production as a side effect. One specific category worth knowing about is a class of medications commonly used for blood pressure management. Some people taking medications in this category develop a persistent dry throat clearing sensation and increased mucus production as a documented and recognized side effect. The mechanism involves a naturally occurring substance in the body that these medications allow to accumulate. And that substance, in some people, triggers an irritation response in the throat. If you take blood pressure medication and your persistent throat mucus began or worsened around the time you started that medication, this connection is absolutely worth raising with your prescribing doctor. There may be alternative medications in a different category that control blood pressure just as effectively without this particular side effect. I want to be absolutely clear. Please never stop or change any prescribed medication on your own. Always have this conversation with your doctor first. What I am saying is that this connection exists, it is medically recognized, and it is worth discussing if you suspect it may be relevant to your situation. Before we get to the fourth cause, and the practical plan that ties everything together, I want to ask you to do something right now. Think of one person in your life who has been dealing with this exact problem and has been told it is just their age. Share this video with them right now before you forget. The share button is right there. Don't wait. What you share today could save someone months more of unnecessary frustration. Now let's finish with cause number 4 and your complete action plan. Cause 4. Environmental irritants and inadequate hydration. These two factors often work together, and their combined effect on throat mucus is far greater than either one alone. Air that contains tobacco smoke, whether from your own smoking or from regular passive exposure, damages the tiny hair-like structures in your airways that are responsible for sweeping mucus upward and clearing it naturally. Even if you stopped smoking years ago, the recovery of these structures is gradual. Other environmental irritants, including wood smoke from fires, strong cleaning product fumes, heavy traffic pollution, and dry heated or air-conditioned indoor air, all create ongoing low-level irritation that triggers continuous mucus production as a protective response. Dehydration compounds this significantly. When your body is not adequately hydrated, the mucus it produces becomes noticeably thicker and stickier. Think of the difference between honey straight from the jar in cold weather and the same honey slightly warmed. The composition is identical, but the consistency changes dramatically. Your mucus behaves in a similar way. Well-hydrated mucus is fluid and easy to clear naturally. Dehydrated mucus is thick and sticky and accumulates in the throat rather than being cleared efficiently. And here is the important point about hydration for older adults specifically. The thirst mechanism becomes less reliable and less sensitive as we age. You can be meaningfully dehydrated and not feel particularly thirsty. This means that if you are waiting for thirst to prompt you to drink, you may consistently be operating in a state of mild dehydration without realizing it. A practical target for most adults is around 30 milliliter of fluid per kilogram of body weight per day from all sources, including water, herbal teas, soups, and water-rich fruits and vegetables. Asterisk Pro Tip 3. Start every morning with 1 or 2 glasses of plain warm water before anything else, before coffee, before breakfast, before your morning medications. Warm water first thing in the morning activates the digestive system, begins the rehydration process after the overnight fasting period, and immediately begins to thin and loosen the mucus that has accumulated in the throat overnight. This single simple habit costs nothing, and many people report it as one of the most noticeable improvements they make for morning throat clearing. A note on common remedies that don't work as well as people hope. Let me address a few popular remedies that unfortunately do not work as well as people expect. Sugar with lemon is a popular home remedy, but sugar is actually a dehydrating agent that can draw moisture from the tissues of the throat, potentially making mucus thicker rather than thinner. Honey has genuine soothing properties and can calm irritated throat tissue, but it does not address the underlying causes of mucus production. Dairy products do not create mucus from nothing as is sometimes claimed. But in some people, the specific proteins in milk can create a sensation of increased thickness in existing mucus, particularly if there is any degree of underlying sensitivity. If you notice that dairy consistently worsens your throat symptoms, it is worth reducing it temporarily to observe whether there is a meaningful difference. Your complete practical plan. Starting today, let me bring everything together with a clear, practical plan you can begin right now. Tonight before bed, eat your last meal at least 3 hours before sleeping. Raise the head of your bed with a simple wedge under the headboard legs. Drink a full glass of warm water before bed. Tomorrow morning, begin your day with 1 or 2 glasses of warm water before anything else, before coffee, before breakfast, before medications. This week, purchase a simple nasal rinsing device from your pharmacy and begin daily warm saline nasal rinsing, morning and evening. Make an appointment with your doctor to discuss your current medication list specifically in relation to your throat symptoms. Ask about any medications known to affect throat mucus production or that may be contributing to acid reaching the throat overnight. And commit to staying consistently hydrated throughout the day rather than waiting for thirst to prompt you. Your throat has been telling you something for a long time. That persistent mucus is not an unavoidable part of aging. It is a signal from your body that something in your environment, your diet timing, your sleep position, your hydration, or your medications deserves attention. Now you have the information to respond to that signal intelligently, rather than just managing the symptom day after day indefinitely. In my next video, I am going to talk about 5 specific foods that some research suggests may actively support throat health and help reduce inflammation in the airways naturally for adults over 60. You are not going to want to miss that one, so make sure you are subscribed and have your notification bell turned on. If this video gave you something genuinely valuable today, a new explanation, a new direction, something you wish you had known months ago, please do 3 things right now. Hit the like button. It helps this information reach more people who have been dismissed and told to simply accept this as part of aging. Subscribe to this channel if you haven't already and turn on the bell notification. I release new videos every week on the practical health topics that your doctor may not have time to cover with you. And share this video with someone you care about who has been dealing with the same persistent throat clearing. That share could make a real difference for them. Remember, this video is for informational and educational purposes only. Always consult with your personal doctor before making any changes to your health routine. I'm Dr. Adrian Volker. Your throat has been asking for the right information for a long time. Now you have it. I will see you in the next video.